The Affordable Care Act provides medical insurance plans for individuals and families around the country. Still, many families struggle to find a health plan that meets their needs at a reasonable price. In this town hall, experts will guide you to resources that can help you to find low-cost and, in some cases, even no-cost plans for individuals, children, and families. Don't miss Your Health, Your Choice. Coming up next.
Thank you to the Eunice Joyce Gardner Charitable Foundation for its leadership support of the Health Channel.
Hi there and welcome to Your Health, Your Voice, an Affordable Care Act Town Hall right here today. We're here to help you understand how the Affordable Care Act, signed into law in 2010, may help you find low cost or even, in some cases, no cost coverage for you and your family. Here to help us is an excellent panel of experts. So let's start with Dr. LaToya Lewis, who is Associate Professor at the University of Miami, and Dr. Xonjenese Jacobs, Director of Florida Covering Kids and Families, and Ivy Patron, Senior Director for Regional Business Development from Florida Blue Insurance. Thank you, ladies, for joining us today. Thank you so much. So now, as we begin, we'd like to share 2 videos of people who are satisfied with their coverage under the ACA. First, let's listen to Bruce's story.
For me to have health insurance is super important because I have a family, because I have a home, and I wanted to create stability. I want to keep stability. I'm Bruce. I live in North Carolina. I am a serial entrepreneur. I own a digital marketing agency, a coffee shop, and I spearhead Black Wall Street Business Incubator. As an entrepreneur, it is extremely important for you to have health insurance because nobody is giving it out. It's something I had to figure out, but it was highly important for me to have it because without it, I wouldn't be able to do the things I do and feel comfortable doing it. Healthcare.gov and finding affordable options really surprised me. I actually was kind of blown away because I thought it was going to be super expensive, but they were competitive rates. Key, find it. Wow. So for my family, I pay $130 for everything when it comes to our dental and our health, and paying $130 a month is pretty darn good. Healthcare.gov has been a great resource to me and my family so I can continue to live my dream.
And next, here's Jennifer's story.
So my name is Jennifer. I live in Virginia. As a self-employed tutor, healthcare.gov means security for me, financial security. A positive 5. As a sole proprietor, it really does come down to me. If I'm not in my chair tutoring, I am losing money.
Okay, perfect.
If you don't have health care, then you are pretty much one medical emergency away from bankruptcy at all times. And that's, for me, why it's important to use my health care for preventative measures, going in for annual checkups, well woman visits, and things like that. If you go to healthcare.gov, you're going to be able to find a good deal because there's a lot of providers and there's a lot of options. My rate actually has gone down significantly, and I can also every year choose a plan that works for me. Healthcare.gov is peace of mind.
Hey Sandra, how are you?
Because now I know that no matter what, I can find an affordable plan where I can go to the doctor, take preventative measures, and live my life.
Those videos were produced by the Department of Health and Human Services. Here's some basic information. The Affordable Care Act allows individuals and families to access health insurance through a marketplace where Americans can purchase federally regulated and subsidized health insurance. To qualify, you must sign up during an open enrollment period. You could still be eligible if you lost health coverage, had a qualifying life event such as getting married or divorced or giving birth, or adopting a child, moving, or other similar life changes. Dr. Lewis, let's start with you. How did the Affordable Health Care Act really change healthcare coverage after it was signed into law nearly now 15 years ago?
Yes, so many people are not aware that it's been such a long time period since it started. And how it has changed and evolved is it has tried to provide opportunities to individuals who do not currently have insurance. And what that has created for is an opportunity for them to seek additional preventative care as well as long-term care treatments that were not previously accessible. In addition, it helps provide insurance to individuals who, let's say, for instance, had previous chronic conditions, hypertension, diabetes, and they were not able to previously get insurance. Now they're able to get insurance and they're not excluded from that opportunity.
So would you say that those who benefit most, there was a real fear among people who had previous health issues. Would you say that they have benefited most, or have you seen other communities really benefit from the ACA?
So in regards to that, individuals from underrepresented communities have benefited from it because there was a goal to help bridge the gap with health inequities. In addition to that, individuals that had low socioeconomic status, as well as chronic conditions, and small businesses have also benefited from the opportunity of creating the Affordable Care Act.
Dr. Jacobs, thank you so much for being here. You are a coordinator or a navigator for the Affordable Health Care Act. Yes. Tell us how you were able to help people.
Absolutely. So at Florida Covering Kids and Families, we have the Covering Florida Consortium, which consists of multiple navigators across the state of Florida. We have over 150 navigators, and what we do is we help to support individuals with getting access to the health insurance marketplace, from applying for the coverage, understanding what subsidies are, ensuring that they understand what plan options are available to them, and giving them all of the resources that they have to be able to access their care and utilize their care more efficiently and effectively.
Thank you. And Ivy Patron, forgive me, thank you so much for being here with us. Ivy, absolutely, like many health insurance companies, Florida Blue has many Affordable Care Act plans, more than 100 of them, I believe. So why are there so many, and why, even with a wide range of plans, are millions in Florida, why are millions of people uninsured?
So it's really hard to say exactly why so many people don't have health insurance. It can range from perception that I can't afford it. Sometimes, they feel that they don't need it. Really, when it comes to health coverage, everyone is so different. And that's why Florida Blue has so many plans to choose from, because we're trying to fulfill the different needs and budgets of the community. Believe it or not, we've actually scaled back a number of plans, as have many other health insurance companies, to help ease a little bit the confusion. We did get recent feedback from health plan members that showed it was really difficult to shop and select a plan with so many options. And actually last year, the federal government reduced the number of health plans offered on the health insurance marketplace, which many know as healthcare.gov, really to try to simplify things for the consumers. And actually last year, there were about 1.2 million uninsured Floridians who qualified for health insurance marketplace plans. And about close to 500,000, that would be about 38% of them, could have qualified for a $0 monthly payment after the financial help, which is, what we also know as the subsidy. I'm trying to think. Affordability really, still remains our #1 priority. And we strongly believe that people deserve access to high quality, affordable health care. And, we really must build a healthcare system that sort of works for everybody. We understand, that people are looking for convenience, and affordability is still top of everyone's mind. And with about 6 out of every 10 adults having an ongoing condition, we know it's more important than ever to help people stay connected to their doctors and stay healthy.
Well, thank you for all that you ladies do. Many of us are very familiar with gold, silver, and bronze medals, right? But when it comes to the Affordable Care Act, gold isn't necessarily the best fit. And there's one more category, platinum. Now, of course, if we just thought about what platinum meant, right, we would think that it is the best. The graphic shows bronze plans. They have a low monthly premium. higher out-of-pocket costs, and higher deductibles. Bronze plans are best for those who rarely see a health professional, while silver plans have a higher premium than bronze, but lower out-of-pocket costs and deductibles. Silver plans may work well for people who are eligible for cost-sharing reductions based on their incomes, and the gold plan, they have higher premiums but lower out-of-pocket costs and lower deductibles. So if you have chronic medical conditions and see healthcare professionals often, a gold plan may work for you. Now, we were just talking about platinum. There are only a small number of platinum plans, and they are for people who want the lowest out-of-pocket costs and deductibles and are willing to pay the highest premiums. So here's a breakdown of the percentage the insurance company will pay and how much the customer will pay based on the plan. You'll see with bronze plans, the insurance company pays 60% and the consumer pays 40% of medical care. Silver has a 70-30 split. The insurance company pays 70%, the consumer 30%. Gold is an 80-20 split, and platinum is a 90-10 split. So, Dr. Jacobs, this is your expertise right here. How much does an individual or family pay depending on different factors? So, most important among them, what is the income depending? What is the plan according to their income?
Absolutely. And so as Ivy mentioned earlier, there are those subsidies, which are otherwise known as advanced premium tax credits. And what they do is reduce the cost of your health insurance. And so with the range of the plan levels, so we're talking about the bronze, the silver, the gold, the platinum, the differences in them really center around whether or not a person makes a certain income in order to qualify for those subsidies, and also the additional cost, which will be cost reductions, which is cost sharing reductions. And those cost sharing reductions actually drive down the cost in addition to driving down those deductibles and those max out of pockets. So it's almost like when you make a certain income between that 100 and let's say 200% of the federal poverty level, somewhere between let's say like 15,000 and upward toward like that 30,000 for a single person household, really it turns that silver plan into something that looks more like a platinum plan. So really and truly the cost sharing reductions actually helps those individuals whose income may be lower, so that way they're not actually having to pay more out-of-pocket costs for their care, and it works within their income range just to really kind of keep those costs reduced and to make sure they can manage their health care services.
Well, I'm glad that you're out there, Dr. Jacobs, because it seems like a lot, but to have a gentle person like you explaining that. And then, of course, Ivy, I want to come back to you, and please explain the subsidies and how they work to keep costs down, if you could go further into that.
Absolutely. So the Affordable Care Act offers, help to reduce these monthly premiums and the out-of-pocket cost, and that's the subsidy that Dr. Jacobs is mentioning. And these are calculated, depending on your age, your income level, the number of people in your family. And based on this, you may qualify for, a lot of money off your premium. Many people actually qualify for a $0 plan. Some of the examples that we have of subsidized coverage, include not only the marketplace insurance, the healthcare.gov, but also Medicaid and the Children's Health Insurance Plan, which we know is CHIP. In states that have expanded Medicaid coverage, your household income has to be below the 138% federal poverty level to be able to qualify. But in all states, your household income, if it's between 100% and 400% of the federal poverty level, you can qualify for a premium tax credit. And this premium tax credit gets actually paid directly to the insurance company, so it's really reducing your insurance costs. Really important, if you're eligible for financial assistance through the premium tax credit or the subsidies, as we know, the open enrollment period is really when you can sign up for that. And that starts November, and it ends in January 15th. So, really look for it. Navigators are excellent resources. Your agent is a great resource to help you understand, where you would qualify. And, keep in mind that last year, more than 90% of the people who actually bought insurance on the marketplace received some type of financial assistance. More locally, 1 in 3 Floridians got a plan for about $10 a month, which, was after the subsidy. But we do encourage people to please always go look and check. Don't assume that you can't afford it.
And Ivy and Dr. Jacobs, if you can just remind us of what the the poverty line, the government poverty level is right now, there might be people that are watching that are wondering if they too can go ahead and sign up and what that would look like for them.
Absolutely, Ivy. I didn't know if you wanted to take it, but really and truly, really looking at a single family household, it starts at $14,580 for individuals who are single persons, and then it goes upward from there. And then when you start getting towards a household size of 4 at 100% of the federal poverty level, it hangs out right around that 30,000 mark and then upward from there.
Thank you so much for that information. Dr. Lewis, you are educating the future of medicine, mainly nurses, but you encounter a lot of young doctors. How are you preparing them to speak with their patients, particularly maybe this patient has a small business and the ACA is the only way they can get help? What are you and your colleagues doing in the education field to help them navigate these feelings and this real truth for a lot of people?
Yeah. So currently as nurses, our focus are to focus on the holistic aspect of care, and that reflects in other aspects of healthcare as well. So we want to focus on your physical, your mental, psychosocial health, and any additional needs. In the hospital setting, we work with great case managers, social workers, who are very knowledgeable, as our guests are here, regarding how to effectively receive care, what does it look like for any preventative care, because most of the patients that come to us may be newly diagnosed with an illness, or this may be an acute episode in their lives. So we want to make sure that we connect them with resources through our interdisciplinary and multidisciplinary rounding to help alleviate those concerns. In addition to that, our goals as nurses are also to focus on the overall prevention. So I encourage my students, when they are providing care and once they transition to practice, you can also look up additional community resources that are beneficial for the patient and incorporate the patient and their family in this process, because it takes a community to keep an individual healthy. So those are the key aspects that I incorporate.
Dr. Jacobs, want to go back to you and your work that you do. Your organization is called Covering Florida for Kids and Families. Tell us about children in Florida that can be covered with insurance even if their parents choose to opt out.
Absolutely. So Ivy kind of mentioned it a little bit when she talked about the opportunities for children to have access to Medicaid and also CHIP programming, which is otherwise children's health insurance programs. And so there's Florida Kid Care, there's children's medical services, there's all kinds of options that are available for children and families. And so at Florida Covering Kids and Families, we have 2 programs, one of which is our Covering Florida Navigator partnership. And then we also have our other program, which is Florida Connecting Kids to Coverage. And so we have assisters that work with agencies and entities across the state to ensure that children are enrolled in Medicaid and CHIP coverage options, as well as children medical services. So they can reach out to a navigator with, through Covering Florida, or they can reach us at with Florida Covering Kids and connecting them to coverage.
That's great to know that that support is there. And Ivy, you have the Florida Blue Centers around the state. Can anyone walk into a Florida Blue Center and get free information about different plans, even if they're not a Florida Blue customer?
Yep, the simple answer is yes. Our Florida Blue Centers have really been a trusted place for health solutions in the communities we serve, really helping members and non-members. We want to emphasize non-members achieving better health. If you see these centers, there are about 40 across the state. They're really a hub for health solutions, and they provide information during the ACA special enrollment period, which is outside of the November to January 15th. They also if you're not a member, you can take classes in there. We've got Zumba, we've got nutrition classes. We also have sales and service professionals, and we have so many things. And I don't want to, leave out the nurses, who are so very important. And, they provide health coaching to our members, and they host a variety of community health-driven activities throughout the month. And we actually have that published. Member or non-member, you're always welcome there. If you're looking to take a health seminar, lunch and learn, fitness classes, you name it, we have that. And another point, and really going to what Dr. Lewis was mentioning, we have social workers on site there, and they are really focused on providing health solutions and connecting members that walk in to specific resources that they may need. There may be resources that they're not aware of, whether it be applying for food stamps, whether it be some type of a disability and they need to find specialized care. We really encourage people to come in and utilize those resources, members or not.
If you have joined us before, you know that our town halls have a really wonderful audience and they have great questions. We have one now from Vanessa. She wrote in and asks or tells us, I lost my job last year and with it went my health coverage. I have severe medical condition and I have 2 young children. They both have chronic health issues. And Vanessa really wants to get coverage, but she's afraid she can't afford it. So what options are there for Vanessa? Dr. Jacobs, why don't you take this one?
Absolutely. So there's a gamut of options, but it's always contingent upon income. So ultimately, as we're looking at it, we would look at her individual situation to determine how much money perhaps she's made for the year, to decide whether or not she may be eligible for some of those subsidies and quite possibly some of those $0, 0 cents plans that Ivy was speaking to earlier. We may even be able to help her get support with the children with Medicaid, simply because the amount of dollars that may be made available based upon her income may actually qualify her for Medicaid, and maybe she might qualify for Medicaid. And so really and truly, she would meet with a navigator. We'd walk her through that process and determine whether or not the Affordable Care Act plans would be most appropriate for her, or if Medicaid would be more appropriate for her as an adult woman with children.
We have another question, and this one is from Mark. Mark writes that he's a busy freelance producer and he does need medical coverage for himself and his wife and child. But when he looked into the ACA, he was told that he makes too much money to qualify for the subsidies that we've been talking about. And the premium was like $1,100 a month, and that was too much for him. Are there any other options, Ivy? And if you could talk to Mark about his concerns.
Absolutely. So, we always recommend that people start with a licensed insurance agent, whether it's with Florida Blue or any other plan. They are well versed, they understand all of the different dynamics, and they can really guide you through the process and really get you the assistance you need. So, it's just as helpful to speak to people like, Dr. Jacobs, who can also help you navigate the ACA marketplace. As she explained, there are so many different nuances to make sure you're getting the right plan for you, especially when you're thinking about cost shares. In addition, there are a lot of factors that'll also contribute to what you pay. It's in this case, everything is based on whether it's your age, your income, the number of people in your family, where you live. So somebody, that's in Miami-Dade may have a very different cost than somebody that's in Broward, West Palm Beach. It's not a statewide thing. So please, always inquire with a registered agent or with a navigator. They're very helpful.
That's very good to know that the entire state of Florida does have the different regions, and it could be different price point for everyone. That's very helpful. Dr. Lewis, really quickly before we go into how people can actually utilize all of the resources we're talking about, have you seen that the ACA has helped with those that might have disparities, or you spoke about the underserved before the show?
Correct.
Have you seen it helping?
So initially, there has been a huge gap prior to the Affordable Care Act with individuals that were underrepresented minority population based on the percentage, of course, of our census in the U.S. government. And based on that component, what it has been key and influential in looking at is how can we bridge the gap to those individuals that are underserved. What we mean by that is minorities or underrepresented populations, individuals with low socioeconomic status. These are various groups. And the disparities are important because that influences chronic conditions. It also has a significant influence on who seeks medical care. For example, some individuals may keep with a particular symptom for a longer period of time because they do not have insurance or are considered uninsured. And what that results in the hospital setting is we have patients who are frequent flyers. That is the provider name that we commonly use, but these individuals are are essentially people who are not seeking continuous medical care, and what they're doing is coming to the hospital for the chronic conditions and care. So it is addressing the health disparities, but we still have some work to do.
Indeed, indeed. So we have another question, and this time from Alma. Alma says, I'm 60 years old and I work as a contract employee. I don't have health coverage because I'm too young for Medicare and didn't think I needed it. But recently, Alma went to urgent care because of what she thought was a stomach problem, and it ended up being much more serious. She paid for the exams out of pocket, but she wants to get coverage to help her with long-term treatment. She talked to her neighbor who said that she had to wait for open enrollment in November, and Alma is concerned that her condition may worsen in the meantime. Dr. Jacobs, what would you say to Alma?
Well, I'd say, of course, call a navigator. Of course, that's always going to be my first go-to. But really and truly, what we always want to make sure that we do is we want to look at whether or not Alma will qualify for a special enrollment period. So I know earlier in the segment we talked a little bit about the options of, if a person may have had some life event that may have taken place, moving, changing jobs or loss of coverage in her case. And really we look at that special enrollment to determine whether or not they may be eligible to access the health insurance marketplace. At that point, once we determine whether or not she can access that special enrollment period, a navigator will then walk them through the steps of being able to complete an application, look for subsidies, and get enrolled in coverage.
The time has gone by so quickly. Before we go, I'd like to get final thoughts from each of our panelists. The time has gone by so quickly, and I thank Dr. Lewis, Dr. Jacobs, and Ms. Patron, Ivy Patron, for being with us to tell us about the good work and the availability of ACA. Thank you, ladies, so much for all that you're doing.
Thank you.
Thank you.
Our pleasure.
Thank you to the Eunice Joyce Gardner Charitable Foundation for its leadership support of the Health Channel.
Ivy.
Ivy, can you hear us?
Hey there.
Thank you so much. What a treat. Hope to meet you in person.
I can. Thank you. What an honor.
You
Thank
all were
you, Lifeboy.
wonderful.
What an honor. You guys are just really special. Great information.
Thank you.
And come
you.
visit
You're
us at
great.
a Florida Blue Center. Truly, there are so many great resources.
Wanted you to
Thank
know
you.
this
Have
is-
an awesome
thanks.
evening.
This is going to air a lot of times between now and open enrollment. And you'll be able to even share it with people on social media,
Okay.
YouTube, Facebook, all that stuff.
Awesome.
So thank you for the information. It was helpful for me too.
Yeah,
Thank you.
yeah,
Thank
definitely.
you.
Wonderful.
Thanks.
Everyone,
Real
take care.
terrific.
Thank
Yeah, we
you.
go out, like I say, a lot in the communities, so
Yeah.
I'll use that information.
Yeah,
Bye.
and- bye. Bye.
Totally.